Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. For those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review books, review courses, review videos, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success and would love to work with you if you need it. Now, y'all know I always get into my disclaimer before we get started with our questions. Y'all know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have created and designed based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos, if I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. Just a brief insert. Y'all know that I am doing a practice question course on July the 13th. From 10 to 11:30 a.m. Eastern Standard Time. I will be going through the exam breakdown and blueprint, telling you exactly the areas that each exam shows what they're doing, family, adult, GRO for the ANCC as well as AANP. We'll be doing live practice questions, working through three things for each system. You will get copies of those questions. I will go through how to answer each question type, as well as provide y'all with test taking tips, and we'll conclude with a Q&A session so that y'all can get your questions answered, okay? It is $49. I have a 20 student limit. I think we have 8 more spaces available. So if you're looking to join, come on and join on in with us, okay? You guys, I would love to have you. But let's get into our questions for today. Question number 1. A 42-year-old female presents to the office with complaints of noted vision changes. She states that she has difficulty reading things up close. She states that she hasn't had vision issues in the past. What is the best diagnosis by the nurse practitioner? Is it A, arcus sensilis, B, macular degeneration, C, presbyopia, or D, presbycusis? Take a moment and tell me what you got in the comments, you guys. All right, I always recommend reading the stem of the question first. So here, the stem of the question states, what is the best diagnosis by the nurse practitioner? Now, if they're asking us about a diagnosis, we have to run it back and see what the assessment findings are, right? We got to see how they present it, see what our assessment as the provider was so that we can determine a diagnosis. Now, the patient came in, she's 42. She is complaining about vision changes that she has recently noted. She says she has difficulty reading things up close, and she's never had vision issues before. Now, you guys, you got to go through the things that you know. And even if you're drawing a complete blank right now, think about this. Let's go through the answer choices and eliminate. Arcus sensilis, that doesn't cause vision changes, right? That's that grayish white ring around the cornea that can be secondary to hyperlipidemia, depending on age. That doesn't have anything to do with the vision changes, right? Macular degeneration does. So that's more that centralized vision changes, right? So, okay, even if you're still not sure, you can hold that knowing that it has some type of vision changes. Presbyopia. What is presbyopia, guys? That's your best answer here because think about it. And you should know. If you don't, now you will know. Presbyopia is that farsightedness that you can't see things up close. When people are taking the items and pulling it back, they're reading a book and they're needing to pull it back so they can see it better. And the treatment for that is reading glasses, right? And that typically starts to begin within that age of 40. And it just worsened and worsened. Typically, they say up to age 65, but it starts typically in that 40 age group. When they hit that age, they start to complain of these things. So this is actually normal that this is a 42-year-old female. She's expressing that she never had vision changes, and now she's starting to deal with this. C, presbyopia is your best answer choice. Presbycusis has to do with hearing, y'all. So you should easily eliminate that, right? All right. Question number 2. Oh, and with that presbyopia and presbycusis, do not skim and rush and click the wrong thing because you are just knowing, oop, that's presbyopia and you're hitting the wrong thing. Slow down and pay attention to what's really being asked and presented to you, okay? All right. Question number 2. The nurse practitioner is explaining to the NP student about centralized vision changes with one of their patients. She is explaining that she is planning to do an assessment during this visit to confirm a diagnosis of macular degeneration. What is the best test to complete? Is it A, a Snellen chart, B, Amsler grid, C, the fluorescein dye test, or D, the Ishara chart? I'm probably saying that so wrong, but y'all know what I'm trying to say. Which one do you think it is? Tell me what you got in the comment. All right, so stem of the question, what is the best test to complete? So what are we completing a test on? This patient has centralized vision changes. The nurse practitioner is explaining to the NP student, like, hey, I need to do this particular test to confirm my diagnosis of macular degeneration. And this is one of those things you should know. If you don't put it in there, repetition is the key to retention, but Amsler grid is the test that we conduct to confirm a diagnosis of macular degeneration. One, if you don't know, Snellen chart, you can eliminate. That's for visual acuity, right? The fluorescein dye test we typically do for herpes keratitis. You see that fern-like appearance, right? And then D is for a color visual acuity, right? So B is your best answer, Amsler grid. And then lastly, question number 3, a fundoscopic exam was completed during an annual wellness exam. The nurse practitioner is explaining to the NP student that she noted arteries crossing and compressing some of the veins. Based on these findings, what should be assessed and managed? Is it A, glucose, B, blood pressure, C, cholesterol, or D, nothing at this time? This is common. Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question here states, based on these findings, what should be assessed and managed? All right, so what findings are we talking about? This patient is in for annual wellness. Fundoscopic was completed. The nurse practitioner is telling the NP student that it was noted that some arteries were crossing and compressing some veins. So what are you thinking about? Arteries crossing and compressing veins is AV nicking, right? That's what's happening. As the arteries are damaged, they begin to enlarge and then they compress those veins. So where they're compressing and crossing those veins, it appears as if they're nicking them. So that's where AV nicking comes from, right? So AV nicking is secondary to that those arterial damage, secondary to uncontrolled hypertension, right? So we want to assess and manage that blood pressure. So B is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all make sure y'all meet me back here. If you need any of the resources that I offer, feel free to reach out to the nursing studio at 803-400-6864. You can also shoot a text message to this number or shoot us an email at thenursingstudio1@gmail.com. I offer review books either in an ebook or a paperback option. They are both linked in the bio of this channel. I also offer a self-paced review course where it is broken down by system. There are many quizzes. There are videos for each that you can watch repetitively for family and adult general designed for AANP and as well as ANCC exam. That's also linked in the bio of this channel. And also, if you're looking to have any of my one-on-one sessions, I always say reach out so we can gauge what you truly need because everything is customized for those one-on-ones. You can either use your one-on-one session for a particular weakness, you can use it for exam readiness assessment, or you can do the custom packet over a span of time to take you from unsuccessful to successful or to help you structure your studies and work alongside with me to take you to a successful exam date. Okay, so if you need any of those resources, feel free to reach out, but make sure y'all meet me back here. Happy studying. Bye, y'all.